Now, Bill, I hear from a lot of our members here at TRTA that they're very concerned about this crisis. Give us some feedback on what you're hearing when you go out and speak at local units. What are members most concerned about?
I've spoken at quite a number of local unit meetings this fall, and there seems to be a common thread of their questions. I can almost guarantee you what the question is going to be. And there are no solutions right now. There are no absolutes, I would say. There's no guarantee. Healthcare is not a guaranteed benefit, and I think that's something I tried to emphasize to our members that I'm a retiree. I'm very blessed to have my health care. I value my health care. So, but what I'm hearing from a lot of retirees is that same thing. They're glad to have health care. They feel good about that. Their costs are going up. Their out-of-pocket expenses are going up.
And when they come to you and say, Bill, what can I do? How can I help resolve this situation? What do you say to them?
I'm glad you asked that question. Recently, I was at a meeting, and there were several legislators there. And so that question came up, what can we do? And it's just real easy. Well, number one is you have to contact your legislator. You have to get to know your legislator. They're really friends. They're ready to help us. They need to know what your story is, how it impacts you. Recently, I was at a meeting, and this lady said we were talking about the cost of prescription drugs, going way up, and she said, but the drug that I have cancer. And the drug I have to have is very expensive. And I'm very grateful that I have a prescription drug part of my healthcare program to help offset some of those expenses that I'm out. But I'm still out a lot of money each month, copay, or copays or out-of-pocket expenses. So, my answer to that is tell your story to your legislator. This is the way you get them to understand how it directly impacts you. I'm blessed. I have pretty good health care. My health is, I take a little medicine. But I know there are people that think I should take a lot more medicine. but these people that have a very good friend, it is very important for her to have her medicines every month. And it's a life or death situation for her. And it's just costly. Those are the drugs that are the most expensive. But that's where the cost is coming in for those drugs. I don't have any control over those drugs, the cost of it. But I do have control of saying to my doctor and to my legislator, these are my concerns. This is, important to me. Our members need to make it important to their legislator.